Today we want to talk about a drug that has been overshadowed by the current opioid crisis, methamphetamine, commonly known as meth. Meth acts on your brain by spiking dopamine, the feel-good hormone, to 1000% of its baseline levels. That's 5 times the amount of dopamine output than from cocaine or from sex, so it's no wonder why meth use is rapidly gaining popularity in Hamilton. Recently, there has been an increase in people seeking treatment for methamphetamine dependence. Meth-related deaths increased from 14 deaths in 2012 to 217 deaths in 2017. Recent news reports further highlight that meth, especially in its more potent crystal form, remains one of the most pressing drugs in Hamilton. Some people make assumptions about their own or other people's drug dependency, attributing it to some type of personal character flaw. Words like willpower and self-control get thrown around, contributing to the stigma that alienates drug-dependent individuals, reducing the chances that they will seek help as they start to internalize these messages. In fact, drug dependency is the result of complex neurobiology in the brain. There's a reason why you might have strong cravings that other people might not experience, and there's a reason why relapse is so common after drug abstinence. There's a lot going on in your brain that you were not consciously aware of. Let's take a closer look.
How does the brain's reward circuit affect meth cravings, meth dependency, and relapse? When an individual consumes meth, dopamine is released in the reward circuit of the brain. The release of dopamine leads to the pleasurable high associated with drug use, which is why meth is so addictive. While these effects might make someone feel good in the moment, raising your dopamine to toxic levels creates long-lasting damage to your brain, largely because of a protein called BDNF. BDNF is a protein found in the reward circuit, amongst other places in the brain. This protein helps to create new brain cells and brain connections. When you have higher levels of BDNF, your brain tends to have more dopamine-responsive areas in the reward circuit. Increases in dopamine-responsive areas means that dopamine has more of a chance to come into contact with these areas to cause the rewarding effects of meth. Meth tends to create higher levels of dopamine release, as well as more dopamine-responsive areas in the reward circuit, making you much more sensitive to dopamine. More sensitivity to dopamine results in more risk-taking behaviors, meth cravings, and potentially relapse. During withdrawal, the amount of both BDNF and dopamine-responsive areas in your brain are at an all-time high, which is why the maintenance stage in recovery is so hard. Drugs that block these dopamine-responsive areas help reduce cravings by reducing your sensitivity to dopamine, and so these blocker drugs may be used to help make cravings a little less intense. The increase in BDNF that occurs following meth use might be your brain's way of protecting itself against damaging levels of dopamine in the reward circuit. The thought behind this is that too much dopamine release in response to meth is toxic, resulting in the loss of brain cells and connections. In response to this brain damage, your brain produces more BDNF to help regenerate these cells and connections. This is a good thing because it means that your brain is trying to heal itself. But the bad news is that higher levels of BDNF typically mean much stronger cravings, making it difficult to maintain abstinence. So just to recap, meth use increases BDNF, leading to more dopamine-responsive areas in the brain. This basically means there's more of a chance of dopamine coming into contact with these areas to cause rewarding effects. Increases in dopamine-responsive areas and dopamine mean intense drug cravings, resulting in meth use and/or relapse following meth withdrawal, which is why drugs that block these areas can reduce meth-using behaviors and relapse.
An important brain structure that is affected by meth is the hippocampus, the learning and memory center of the brain. Meth-dependent people have a smaller hippocampus. Believe it or not, the hippocampus contributes to drug-seeking behavior and meth dependency during the early stages of drug use. The hippocampus provides the memory of the pleasant experience you had with meth, which motivates you to use the drug again. Meth changes the structure of the hippocampus, which causes increased craving in meth users and ultimately contributes to relapse. Thankfully, cognitive behavioral therapy, CBT, has been widely recognized and used as treatment for addiction. CBT is a type of therapy that encourages the patient to develop problem-solving skills and learn coping skills to help end their addiction cycle. Frequent CBT sessions increase functioning in different parts of the brain, including the hippocampus, resulting in better memory and learning skills. Treatments involving CBT help patients reduce meth use and gain positive strategies to help cope with their addiction.
Hopefully, we've been helpful in providing information on how meth craving, use, and relapse are due to neurochemical changes happening beyond your conscious experience. Following this, any deviations from the path of recovery should not be looked at as a step back, but as an opportunity to rewire the circuits that have been created as a result of learned experiences. Ultimately, dependency says much more about how the human brain works than it does about any supposed flaw in character.